I am Dr. Jothydev, diabetologist from Trivandrum, south of India. For most of us, COVID-19 has created a war-like scenario. But this is not the time to panic. This is not the time to panic. This is a time to train the children, and this is a time to train the community and the people around on the best hygienic practices. And COVID-19 has affected almost all the continents except Antarctica. And I will say that for the first time the world is united. The world is united in the fight against one of the fastest growing virus in the world. Don't be afraid. Don't be afraid about this virus, since more than 80% of the affected individuals are making a complete recovery. It is a well-known fact that respiratory illnesses such as influenza and pneumococcal pneumonia, they are 3 to 4 folds higher in those subjects with diabetes. And these illnesses results in 3 to 4 folds higher chances of hospitalizations and even death in those subjects with diabetes when compared to those without diabetes. And hence, it is customary and it is a recommendation since several decades to vaccinate our patients with diabetes against pneumococcal pneumonia and with yearly flu vaccinations. And this is applicable even for those children, kids with type 1 diabetes. And it's followed. It is something which is practiced by all of us. And for corona, for COVID-19, there is a very high chance of hospitalizations and a severest form of disease in the presence of uncontrolled diabetes. So patients need not be worried. You have to worry if the diabetes is not under control. You have to practice more self-monitoring of blood glucose at home. If possible, use a continuous glucose monitoring device and ensure that the glucoses are not above 180 milligrams per deciliter. Consult your doctor on how you can control with multiple daily injections. And this is very similar to the sick day management of diabetes. In diabetes, there is a higher expression of angiotensin converting enzyme 2, and the ACE2 is a functional receptor for coronavirus, including COVID-19. And some of the antihypertensive drugs are supposed to increase the levels, and there is an ongoing controversy. But as of now, all the scientific organizations have advised patients to continue the same therapies and not to change, since it is not proven to worsen the disease. In the presence of diabetes, please remember to boost your immunity. In the presence of diabetes, to protect against COVID-19, control your blood sugars more aggressively if possible, sleep adequately 8 to 10 hours every night, exercise regularly, minimum 30 minutes per day, and try to gather your supplies at least for 2 months. Oral medications, insulin, glucose meter, and the glucose meter strips, and the emergency supplies for treating hypoglycemia, such as honey, jam, and so on. And if you are having diabetes, I will say that if you are having diabetes, maintain a social distancing, at least for 1 to 2 meters, and avoid contact with those who are having a mild fever or a running nose. And that is going to save you. That is going to save you. The mortality rate in COVID-19 is very, very low. So be confident. Be confident with diabetes to fight against COVID-19. How long will this scare last? Honestly, we don't know. We don't know. But from the experience gathered from Wuhan in China, from Italy, and from Spain, this is going to last for another 2 to 3 months' time. So So until then, we need to practice social distancing. We need to ensure that this doesn't spread into our community. We need to practice frequent hand washing and more frequent use of hand sanitizers, and to avoid handshaking, avoid non-essential travel, and avoidance of crowds. We will definitely win over this virus.